All right, little housekeeping for you. One of the things that you may have seen in your program and you're like, what's that? There's a session today at 11:30 till 1 o'clock. It says Ask the Expert. Well, a lot of our presenters here yesterday and today, I don't think all of them, many of them were going to be in the exhibit hall space over there for about 90 minutes. So if you want to track some of the folks down, go to our NAF booth. And you'll be able to ask and find out where they may be seated. So you might be able to get a nice personal interaction with some of our presenters. Speaking of presenters, our next presenter is going to be discussing how to gain local resources, access to local resources. And Sandi she's got a wealth of knowledge. Sandi's been a nurse for 41 years, and she's the past president of the American Association of Neuroscience Nurses. She's been most recently working in neurosurgery at Penn State University. I know she'd like me to end this introduction by saying, "We are," so I will. Please welcome a member of our board of directors and our next presenter, Sandi Brettler. Sandi, how's that? All right.
So I have to answer that. We are with Penn State. For those of you who don't know, that's their big chant. But I want to thank you for inviting me here. To talk about some of the accessing of the local resources and national and a state level as well. This is a lot of information on these slides. I recommend if you want it right now and you don't want to wait for the 6 weeks or so, just to take a quick picture of the slide. Disclaimer, of course, with the NAF, this is our standard disclaimer for that. And I have no commercial or financial interests to disclose at this point. I do work for Penn State Health System at the Hersey Medical Center currently for another 90 days until I retire. And I am currently a board, yay! I'm currently a board member for the National Ataxia Foundation. So I was asked to talk a little bit about accessing some of the resources that are out there for ataxians and how to go about finding them or getting them. There are lots, but so many are hidden. For our ataxians, it can be daunting, to say the least, when you go out there searching. So talking a little bit about these different groups, so starting at a national level, of course, the National Ataxia Foundation is one of the best resources out there. You can get to their webpage. They have all sorts of resources, from some of the local resources to support groups to identification cards for ataxians to carry with them. That is one of the best places to go, just abundant resources. Other groups that you might see included other movement disorder groups, FARA, the Friedreich's Ataxia Research Association, Parkinson's Foundation, because it's also a movement disorder. The National Essential Tremors Foundation also has some great information, and they can help you find information more at a global level as that goes through. The National Organization for Rare Disorders is patient assistant programs that help you access things like getting medications, getting testing done, diagnostics, caregiver support, and other needs. Then you think more along the lines of the Lions Club, and of course I think of that as a local type of thing, but it's really a national and international. The Lions Club helps deal with vision changes, vision problems. So if you're having those and you need assistance getting prism glasses or other types of visual care items, they can help. Diabetes and also disability assistance. They do have wheelchairs that they give away and different things like that. So the Lions Club, the Kiwanis Club, focuses more on children, children with disabilities, health and nutrition. And then you have other charitable organizations like the Rotary Club, the Elks Club, the Moose Club, some of the police organizations, the Veterans of Foreign Wars. They do have, believe it or not, resources available for the disabled. The Ataxia Centers of Excellence is another great place. They can help you find medical care, research study opportunities, certain medications. The National Association of Elder Law Attorneys, or the Academy of Special Needs Planners, attorneys, financial planners, and trust officers that can help you set up trusts for persons with disabilities, special needs trusts, long-term care needs, estate planning, nursing home planning, things like that. There was a group I met here last year, the Consolidated Planning Group, who were parents of an ataxian who gave a lot of great information on how to set up a trust if you're a parent of a child with a disability and how to deal with those sorts of things. Global Genes is another nonprofit advocacy organization for individuals and families fighting rare and genetic diseases. The United Way has some early intervention programs that can assist school-age students with either in-home or in-school therapy programs. They help you get assistance and other services from the school's IU as well. I went the wrong way, apologies there. Some other national groups that you might see, the U.S. Disability Services, they do have information available out there for you to find. The National Center on Health and Physical Activity and Disability. These are all programs that are still out there and available. Check into them. They do have funding available. They do have grants available for all sorts of types of things. The American Neuromuscular Foundation also has good information just with reference to exercise, promotion of health in folks who have the neuromuscular diseases, and they can help you get to some of those resources that you might need. Believe it or not, the Easter Seal Society, which has been around for quite some time as well, does have assistance with mobility devices and finding assistance with medication and testing. The Special Needs Alliance, the Disability Partnerships, and the American Association on Health and Disability also have that kind of information out there and available for you. This at a statewide level, and some of this is sort of cross barriers, states and national information for you. Medicare and Medicaid, the SSDI and SSI programs, they have waiver programs to help with in-home care. If you're a caregiver, they can assist you in getting paid to be a caregiver. If you've had to leave your job that you've been doing for many years and now you're caring for a child, a parent, a spouse, a partner with a disability, they can help you get that assistance. And so there's of course, a lot of paperwork. It's very governmental focused, lots of red tape to go through, but it does help, and it can help there as well. Partners in Policy Making, and that's a free leadership training program for adults with disability and parents of children with developmental disabilities to become community leaders and catalysts for systems change. It's a very competitive program. It lasts for several months, so it's a big time commitment as far as that goes. But they do have those in every state. You just have to check your state website and you can find that information. Independent living centers, that is huge in every state. It's a community-based, cross-disability, nonprofit organization that's designed and operated by people with disabilities that provides services and advocacy to help individuals with disabilities live independently. There are currently 403 centers across the United States, 330 branch offices, and 56 statewide independent living councils. So do check them out in your state. You can just very easily, type in independent living center and whatever state you're from, and you'll get a lot of information out there. The OVR, or the Office of Vocational Rehab, this is an office that's available, for any disability or impairment that results in substantial impediment to employment. They provide vocational services to help people prepare for, obtain, and retain employment. So it does receive funds from both the state and national or the federal government, but there are voc rehab states offices in every state. And I just know that in the state of Pennsylvania, which is where I'm from, that can also assist students with college tuition, books, those sorts of things, and it will pay for the equivalent of a community college tuition for every semester that's out there to help them get jobs and get the education that they need to continue on. Other general resources you'll find generally on your state website. I just chose Nevada because that's sort of where we are. They have an app or a location on their website called Nevada 211, and that's a free service that provides information about health and human service programs that are available through the state. So there is transportation assistance here in Clark County and also in Washoe County, where disabled residents can apply for coupon books for discounted taxi fares, and that'll get them to the casinos. So, of course, as per all regulatory things, there's a lot of paperwork for them to have to fill out for that. Illinois Department of Health and Human Services has something called the Aid to the Aged, Blind, or Disabled cash program, and that's available for folks who are elderly, blind, or have a disability, and they need money to help take care of medical care or care for themselves. Helps to pay rent, services, medical bills, transportation to and from appointments. So again, every state is a little bit different. Do look into those ability programs at the statewide level. It's usually PA, like in Pennsylvania, it's pa.gov, or Nevada, nv.gov. So take a look at those and see what you can find. Transportation mobility assistance. So there are lots of groups out there that do provide assistance. So you met Jack Perme last night and his mom, Monica. They have a group called Moving Forward for Ataxia. Jack and his mom, they raise money to donate trikes and bikes for ataxians. Jack gave one away last night to Daniel, so have fun. You'll see him out on the road, hopefully safely, and wearing, as Monica said, wearing a helmet. But that's something that you can look into for that. That's an awesome way to get around for ataxians that may not always want to sit in a chair, but they can get out and exercise and ride a bike. The VFW, apologies, you don't have to be a vet to get assistance. They donate many healthcare items, so just look into your local VFW or American Legion, and they do have those items available. They also do offer grants and assistance for you if you need help paying rent, paying medical bills, things like that, so they are available. Local churches, flea markets, estate sales, thrift shops, Facebook Marketplace, or even there are Facebook free groups that give away a lot of things. I know that after my father passed away, we actually donated quite a few of his items to different people that we knew who needed things. He had an electric wheelchair, he had 2 regular hand wheelchairs that we did, some walkers, some canes, but they're all out there, and people, are willing to give them to you either free or at a discounted, a lower rate. And then certainly, I know my brother found a wheelchair at Goodwill for $10 for my dad, and it was a perfect fit. So those are also some things. And even local churches or temples do have extra items that they're often willing to give. I know at my clinic, at my hospital, people often leave canes or walkers there, and they're like, oh, I don't need it anymore. They have movement therapy, and they have a DBS, a deep brain stimulator, that gets turned on, and they'll say, oh, I don't need that cane anymore. You can leave it here and give it to somebody who needs it. So we have quite a collection. You can pretty much choose from what you want. Stellantis has drivability grants and some funding that's out there and available. It's local assistance to purchase vehicles or assistive equipment for your vehicle. Of course, you do have to fill out a grant application for them, and they will hook you up with a local car dealer to help you find that information, as well as Mobility Works, which are car and van manufacturers that offer cash assistance or reimbursement, if you've already paid for it, for the installation of handicapped equipment in many vehicles like GM, Honda, Ford, Hyundai, Nissan, Subaru, Volvo, Jeep Ram. That would be a big one, getting a Jeep with all sorts of things. But they do work with your car dealerships, and they do provide that reimbursement for the assistive devices that are there. Additionally, we've got air transportation or mobility assistance, and as many of you, I think there's not a lot of you that live here in Las Vegas. There are a few, but those of you who flew in here, you can get a TSA notification card that you are a person with a disability, and that will help get you through security clearances. Generally, you just have to call, 48 to 72 hours prior to traveling to request the assistance of a passenger support specialist at the checkpoint area. If they're not available, you can ask for the supervisor at the TSA office at the checkpoint area, and you can be screened in your wheelchair or your scooter if you're unable to stand, or if you can stand unassisted to go through the screener, they can help you out. Just allow for some extra time for that sort of thing. I have listed here the website you can go to, or you can just simply call TSA Cares. They also have these codes, these special codes that they do attach to your tickets. They're called DPNA codes or SSR codes. DPNA is Disabled Person Needing Assistance, or the SSR, which is a Special Service Request. These codes inform the airline staff that the passenger can require additional assistance, such as priority boarding, delayed boarding, or assistance navigating through the airport from the beginning to the end. So at the time you check in, if you need special assistance, just call the TSA office or the airport office, your airline, and just say, I need somebody to help me from the gate to TSA, through TSA, or from check-in and through TSA and out to the gate to get on. Most of these are requested at the time of booking, but if you forget or you want to do it today for your airline ticket now, just call the airline, and most of them can help you get into that code. If you're traveling internationally, and I did hear a little bit about this yesterday with some of our folks from Canada, that it's quite different in different countries. So there's no real consistent rules. The rules that we have here in the United States are quite different internationally. We encourage you to just check with the individual airport authorities at the country that you're traveling to. And they're very unclear sometimes. Sometimes there's no assistance offered, and sometimes they will bend over backwards and practically, walk you to your seat from the front door to the airplane. It's just, again, letting them know that you need extra assistance. There are also ability awareness meetups that are around the country, and these are great places to find a lot of information with regards to what resources are also out there. The Philly Bike Expo just occurred in Philadelphia. The 2026 dates haven't been announced, but I know Jack and Monica from Moving Forward for Ataxia were there and got to see some folks and show their bike and demonstrate their recumbent bike. That was helpful. The Penn State Health Rec Fest, I know Mike Kammer and I are going to be there, and that is different activities for folks who are disabled. So they have tennis clinics there that day, they have rec basketball, they have interpretive dance, they have all sorts of activities that are there in addition to other resources. So people with recumbent bikes, people with wheelchairs, motorized and manual, and then other resources for the disabled. So check out some of those that are close to your home. All you have to do is go to the internet. I know I always hate saying that, but type in Abilities Expo, and it will list a bazillion of them. So some of the local backyard resources that you can get to: high school key clubs. Do you need your yard work done? Do you need your lawn mowed, the leaves raked? Do you need some paint on the back shed? Local high school key clubs are great. They're always looking for service projects. Those are some great folks to get hooked into. Just call your local high school and ask them if they have somebody who can help do those sorts of things around your house for you. Boy Scout and Girl Scout organizations are the same. Your church and temple youth groups have also those accesses. I know some of the local temple groups in my particular area go around and they know who the elderly are, and they rake their leaves every fall. So something you can look at. There are a lot of NAF support groups, so go to the NAF webpage, and there are, just like we had yesterday for the Birds of a Feather group, those support groups are available for you via that particular website. Some of the local gyms also have programs for the disabled. So the Rock Steady Boxing program, that's primarily for Parkinson's patients, but that's a movement disorders group. And that's a great way to get some exercises, because that's something you can do from a seated position or standing. And it does help you to build up some core strength as well as strengthen your legs. And there are also other adapted sports programs that are out there. The hospice and palliative care home health programs, those are if you need additional support beyond what you're able to provide, so they can help you with getting a home health nurse or home health physical therapy or occupational therapy if your family member can't get out of the house. So for those that are homebound, those are great resources. Hospice doesn't necessarily mean that they're going to die. It just means that you need more assistance, and they have a lot of resources out there that they can help provide you. So going to the internet, and I say this all the time, but please be careful. Dr. Google does not have a medical degree. Your neurologist has much more, knowledge about a lot of these things. So stick with those physicians that have this degree. Dr. Google sometimes gives some pretty bad advice. So I always caution people with what you interact with out there. Do start with the National Ataxia Foundation homepage. That is the best resource out there for ataxians. There are other websites that you should look at. The Ataxia Connection, Day Undefined, actually put forth by some of our ataxians that are members here of this association. And they test products for everybody, everyday products like door openers and can openers. And it's a local group. Many of the people in the audience I actually know our product. They check on the different products that are out there and they say yay or nay, like this is a really good one, thumbs up, or this one didn't work so well, thumbs down. So check that one out. Of course, the Ataxia Centers of Excellence, you can find where they are on the National Ataxia webpage, but they will give you a lot of great information as to things that you might need, finding physicians, et cetera, as well as the patient advocate. Facebook groups, who knew? The National Ataxia Foundation has some great Facebook groups out there. There are other ones that are out there. There's private groups and public groups, so you just have to ask to join, or some of you can just join automatically. This is Mike Kammer, who's the leader of the Central Pennsylvania Ataxia Support Group. The Friedrich's Ataxia group has a lot of support groups out there on Facebook. Of course, Bill Nye, the Science Guy, he has some great information. Better Living with the Shelby Show. I know Shelby's here in the audience. Yeah, there we go. Great information, lots of podcasts and real life experience for those folks that are living with ataxia. But please be careful. There are a lot of not legitimate sites out there, and especially some of the research. Oh, we're looking for members to join in this research, or these are some independent doctors. He works alone and out of some remote situation. Be careful of the scams is what I'm trying to say here. Some Instagram groups that you might see, and again, online support groups can be sketchy, so take a look at it. When you type in ataxia on Instagram, one of the first things that comes up is a band. Their name is Ataxia. Nobody in the band has ataxia, but it's a group out there. So Instagram groups, the Ataxia Foundation. I know that's shocking that the National Ataxia Foundation has an Instagram group as well. They've got lots, but Bill Nye has some information out there. He's the ataxia advocate guy, so check him out. And there's also an interesting one I found called Broadway for Ataxia. These are Broadway stars who have exercise groups for ataxians once a month, and it's some of the Broadway stars that are out there, and they come and they do gentle either yoga or sitting exercises. So lots of just good movement exercises that you can check out. So check them out on there, but again, be very wary of some of the sketchy ones. Lots of podcasts and webinar. Dana Morrow, who you met earlier this morning, or you've been meeting or know her from years past, she actually has a podcast on Spotify or Apple iTunes called Ataxia, Did You Know? Lots of different topics, again, lived experience out there. That's a great one. Growing Up with Neurodegenerative Disease, Friedrich's Ataxia, Joni Livingston has a great podcast out there. And again, more lived experience from this young lady. There are other podcasts out there, Degenerative Diseases Special Interest Group through the Academy of Neurologic Physical Therapy. And so their podcasts are basically going through exercises, what you can do, what you can't do. So, things that'll help you, things that might not be as good for you if you go through those things as well. And then I only have a very short time left, but I do want to show you some of these ataxia. Let's see if I can get it in here real quick. So it should come up right here. So this is a rock steady boxing class that starts out actually seated. This is for Parkinson's disease, Parkinson's disorders. You see that? Oh, you can't see it. Is it? It's not up there, sorry. It's actually a Parkinson's disease class that you might be able to see. Let me see if this one will pull up. Nope, it's not pulling up, sorry. So just checking out and a couple things. Little Steps, Big Gains was a therapist that was here last year who gave a talk, and that is a great place to be able to go and get some exercises out there. So some of them are sitting, some are recumbent, some are standing, so whatever you're comfortable with. Some use resistance training, so the PhysioDeft is a physical therapist who will show you some recumbent, so lying on your back, using stretch bands that you can either purchase, and some of the things we were talking last night, like not a lot of people have stretch bands in their home, but there are lots of things in your home that you can use to exercise with. So if you don't have stretch bands, use a pair of pantyhose and tie it around your knees, and that'll give you some resistance in that respect. If you don't have weights in your home, you can start out with a can of Campbell's soup and lift those, and then you can graduate to the big can of Campbell's soup or baked beans, and then you can graduate to a liter bottle of soda and lifting those. Those are different weights. 5-pound bag of sugar or flour. I mean, now you're talking. You're getting some different weights available. So, then you have pets and children and all those other things that you can be lifting. So those are great things to use in your home that you may not ever think about, like, oh, why, I don't have a full weight set or a full gym in my house. No, but you have a ton of groceries in your house and laundry products that you can be lifting using as weights. So those are some great things for you to take a look at. I don't have any time for questions at this point, but I will be out there at the first aid and safety desk during the breaks, and I'll be out there in between. So if anybody has questions, I'm happy to chat with you. I also wanted to just mention that all of these resources that I just put out here, tip of the iceberg. I didn't even come close to talking about all of the things that are available for ataxians as far as exercise, mobility, free things that you can get, grants, products. So do your research, and I'm hoping to meet all of you at some point, just not as the first aider. So thank you very much.
So is that $100?